Welcome to This Explainer. Look, if you or someone you know is navigating polycystic ovary syndrome or PCOS, you probably already know exactly how incredibly frustrating it can be to get clear, straightforward advice. You go online, or maybe you step into a clinic, and suddenly you are just bombarded with fragmented, totally contradictory diet rules. One person tells you that you have to cut out all your carbs, another says you need to buy all these expensive supplements, and a third claims the secret is, drinking celery juice during a full moon. It is just so overwhelming. Well, today, we're setting all of that noise aside. We're going to look exclusively at the latest clinical guidelines from 2023 and 2024 to give you a truly evidence-based, empowering look at how nutrition and lifestyle actually work to manage PCOS. So here's our game plan for today. We're going to start by understanding the PCOS puzzle, break down some dietary patterns, and look at how nutrition actually works in the body. After that, we'll get into the truth about supplements, talk about what matters beyond just diet and exercise, and finally, figure out how to build a plan that's actually sustainable for you. Let's get right into it. Okay, part 1, understanding the PCOS puzzle. To really wrap our heads around this condition, we first have to look at the big picture. According to 2026 World Health Organization data, PCOS affects between 10 and 13% of reproductive aged women globally. Guys, that's massive. We are talking about millions upon millions of women. And yet, even with those overwhelming numbers, so many people suffer undiagnosed for years, bouncing from doctor to doctor, feeling totally isolated and unheard. If you've been struggling with this statistic is proof that you are absolutely not alone. A big part of the confusion honestly comes from how it's been labeled in the past. It's often treated simply as a fertility issue, but modern guidelines tell us we need to totally redefine the condition. PCOS is actually a complex, lifelong endocrine and metabolic condition. It frequently brings along insulin resistance, excess androgens, and significant psychosocial distress. This isn't just about reproductive health. It's a lifelong situation that requires multidimensional management across both your metabolic and your psychological well-being. Moving right along to section 2, breaking down dietary patterns. Because once you realize the PCOS is a metabolic condition, the very next question is usually, okay, so what on earth am I supposed to eat? Patients so often face these incredibly stressful diet wars, being told there's only one right way to eat. But take a second to really hear this quote from the Teed et al. 2023 International Evidence-Based Guideline. It says, "There is no evidence to support one type of diet composition over another." Right? How liberating is that? Let this officially bust the myth that a rigid extreme diet is mandatory for managing PCOS. You absolutely do not have to force yourself into some restrictive box that makes you miserable just to manage your symptoms. And this brilliantly illustrates the point. While no single diet is the universal magic bullet, this 2024 network meta-analysis by Juhas and colleagues shows us that specific patterns really shine when you tailor them to your individual metabolic goals. For instance, the DASH diet ranks super highly for improving insulin resistance and fasting glucose. If your doctor has specifically recommended weight reduction, a structured low-calorie diet has strong evidence. Or for overall anti-inflammatory benefits, a Mediterranean-style pattern is absolutely fantastic. The secret here is nuance. It's all about matching the dietary pattern to what your specific body actually needs. Which brings us to section 3, how nutrition actually works. Let's zoom in a bit and look at the actual cellular science of why your food choices matter so much. I want you to think of your blood sugar kind of like a roller coaster. When you eat meals with a high glycemic load, like really processed sugary foods, you get this massive, steep spike. But by choosing fiber-rich foods, we lower that glycemic load. Smoothing out those spikes leads directly to reduced insulin demand. Your body just doesn't have to pump out nearly as much insulin. And why do we care about that? Because high insulin is a major driver of excess ovarian androgen production. By smoothing out the glucose spikes, you are biologically reducing the production of those excess hormones. It's a complete domino effect. Which leads us to this golden rule. Carbohydrate quality matters far more than extreme restriction. The scientific evidence points squarely towards swapping out refined carbs for lower glycemic, fiber-rich whole foods. You absolutely don't need unsustainable, total carbohydrate elimination to lower that insulin demand. You just need higher quality, nutrient-dense carbohydrates. All right, let's pivot to section 4, the truth about supplements. Now, what's really interesting here is, I know exactly what a lot of you are thinking right now. But what about supplements? What about inositol? Seriously, if you spend 5 minutes on the internet researching PCOS, you are going to find someone calling inositol a miracle cure. It gets incredibly hyped up, but we really need to look at what the clinical data actually says. So here is your reality check. The internet hype claims that inositol is a proven replacement for lifestyle changes and that it just cures everything. But the clinical evidence, specifically from a massive 2024 systematic review by Fitz and colleagues, found that the evidence remains quite limited and inconclusive. Now, let me be clear, this doesn't mean inositol is totally useless, but it is an optional adjunct. It is definitely not a replacement for a food-first approach. Your lifestyle and nutrition remain the true, undeniable foundation of your care. Don't let flashy marketing distract you from the basics.
Let's zoom out again for Section 5, Beyond Diet and Exercise.
Because here is the truth, you simply cannot treat a complex metabolic syndrome just by staring at what's on a patient's dinner plate. A 2023 review by Cowan and colleagues perfectly highlighted this. Things like your sleep quality and daily routines directly affect your insulin sensitivity and appetite regulation. Getting behavioral support and managing your chronic stress are absolutely essential, because being chronically stressed makes sustained dietary change almost impossible. Furthermore, receiving respectful, stigma-free healthcare is a fundamental right, not a luxury. Weight bias actively harms patient outcomes. And yes, weaving in 150 to 300 minutes of moderate activity weekly is vital, but all of these pieces, your emotional well-being, your sleep, your stress, they're just as critical as the food itself. Let's move to our final piece, Section 6, Building Your Sustainable Plan. Listen, the absolute best diet in the world is completely useless if it's not one you can actually stick to long-term. To manage PCOS effectively, you need to focus on sustainable eating patterns rather than strict punishing rules. If weight loss is clinically indicated for you, aim for a realistic 5 to 10% reduction. Research shows that's enough to meaningfully improve metabolic outcomes, so you don't need to chase dramatic, rapid drops. Collaborate with dietitians and healthcare professionals to build a plan that respects your culture, your family, and your budget. And most importantly, if your progress stalls, just adjust the plan. Do not abandon it. Treating PCOS is about lifelong, flexible management. So I want to leave you with this really provocative question to chew on today. How can you build a sustainable, stigma-free lifestyle plan that actually fits your real life? You've got the evidence now from the latest 2023 and 2024 guidelines. You know you can completely ditch the extreme fad diets. You know it's about carbohydrate quality, managing your insulin, addressing sleep and stress, and finding a pattern you genuinely enjoy. It is time to reclaim your metabolic health entirely on your own terms. Thank you so much for joining me for this explainer, and I really hope this empowers you to take that very next step with total confidence.